Okay, we're in business.
Okay.
Hey Siri, turn off flashlight. That's not going. That's all right.
All right. So basically, they went in there,
Right.
and they saw that there's a mass
Okay.
on the head of your pancreas, which is just like the first part of the pancreas. They saw some lymph nodes as well that looked a little inflamed, and some fluid around the pancreas. Okay.
Okay.
So there is a mass there. What we don't know is the origin of the mass,
Mm-hmm.
because it can be one of two things. It can either be a mass coming from the pancreas, or it can be a mass that's called a neuroendocrine tumor. So they took a biopsy. And they took some of the fluid to sample it. And hopefully we'll get results of that hopefully within the week.
Okay.
Okay.
Very good.
Yeah. So we are going to consult our hepatobiliary surgeons,
Mm-hmm.
just because where the mass is in that area of distribution.
Near the liver.
Huh?
Near the liver.
It's near the liver, but it's also more near the pancreas, right? Like it's on the pancreatic head. And we're also going to consult our oncologist as well,
Okay.
just to guide us in terms of like working this up any further. You know, we've gotten full imaging, we got a biopsy, we got some tumor markers. So the question will be, number one, what exactly is it in terms of the biology of it? And number two, how do we treat it moving forward? So I think that's where the surgeons and the oncologists will kind of come in and help us.
Okay, there might be surgery.
Yes,
Okay.
you might need surgery.
Okay.
Okay. I don't know yet, because that's, their decision. And, we'll probably like present this case with like multiple different specialists to see what the best plan of treatment will be. But we know that there's a mass there. We just need to know what the mass is and how to take care of it.
Okay.
Okay?
Not a surprise.
Huh?
Not a surprise. I expected that there would be something there.
I think we did as well, based on the imaging. So now we will make an action plan.
Okay.
Okay? What questions do you have?
Well, I'll be in the hospital for quite a while.
Hopefully not. I think what we want to do before we get you out is just make sure that we have everything in plan in terms of the workup. We've already done a bunch of labs, we've done imaging, you had this procedure done, we have the biopsy, we have tumor markers. That's why we're getting the specialists on board as well, just to see if there's anything that we're missing. Do they need a special type of scan? You can't get an MRI because of the valve issue.
Maybe.
So do we need a special type of scan? Do they need any other blood tests? Right, a lot of this is dealt with in the outpatient setting, but I think that while you're here, it's good to just complete the workup and make sure that you have proper follow-up with the proper people before we send you out.
Okay.
Okay?
Hopefully in Westchester or not.
Yeah. Well, I don't know.
Easier.
I don't know how far our specialists go. Sometimes they have offices that are closer to Westchester, as opposed to having to come to this campus necessarily.
But I want the best, so it might be here, and I'll figure out a way to get here on a regular basis.
Yeah. We'll see about like which one's the closest to you, and we'll try to accommodate you as much as possible.
Okay.
Okay, but before we do all that, let's just complete the workup now.
Good.
Okay, but we have a biopsy, so the biopsy will tell us what this is.
Great.
Okay, and the good thing is that the mass was not causing anything to be blocked, so we didn't need to put like a stent in there. There was no stent required.
So there was dilation of both the liver and the pancreas, right?
There was some dilation of some of the ducts. Yeah, but it wasn't causing a complete obstruction. So things are flowing properly, and we know this because your liver test and your bilirubin is all normal. Right. If it was not normal, then we would be concerned that there was a blockage and therefore that you would need a stent. But it didn't look like it was blocking anything.
Okay.
Okay.
So we'll know more in a week.
We'll definitely know
more or less.
Okay.
Okay.
All right.
Tell me your name. I can't see.
Dr. Paulino.
Dr. Paulino.
Or Dr. Lewis. Doesn't matter.
Okay, Dr. Paulino.
All right. Any other questions? No. All right.
Wait and see.
Wait and see. Yes, sir. All right.
Okay,
Great
sir.
seeing you.
Thank you.
All right.